Good evening and welcome to another MJ show. It's great to be back. It's another Thursday, and we're here every Thursday from 8 p.m. until we are ready to finish. Sometimes we go until 9 o'clock, sometimes we go until 10. So we'll see how today works out. Welcome to the show. And before we get really into it, we're going to have a really awesome guest today giving us some really good information. So get ready to share. We're going to have a quick countdown, and when we come back, we'll talk to Donna Jarrett-Mays all about healthcare, Obamacare, affordable healthcare, whatever you want to call it. We shall be right back. All right, guys, please do share with your friends and get everybody in here. Good evening, and welcome to MJ Live. Welcome to Health Coach Adrienne and also Facebook user. It's another Thursday, and we're going to have an amazing show. You've still got time to invite your friends, tag a friend, share it on Facebook, share it on Instagram, share it on YouTube, share it on your WhatsApp groups as well. Let's get people in here because we're going to be talking about a topic that a lot of people may not have all the answers for. And we have a professional. She's been in the industry for many, many years. She knows all the laws regarding this topic of healthcare, affordable healthcare, Obamacare, whatever you want to call it. But we're going to have the answers. We're going to have the questions answered today. Okay, so we're going to be talking with Donna Jarrett-Mays coming up in just a few short minutes, 1 or 2 minutes. She'll be coming up. But before we get started, I just want to give you guys the opportunity to share. We're going to give you the opportunity to share and get people in here. So welcome, Wayne. Welcome to Adrienne, health coach Adrienne. Health coach Adrienne. I got to check you out as well, Miss Health Coach Adrienne, because you know what? We have such amazing people who can provide value to our audience at all times. So who knows? Welcome, Marva Riley. Marva Riley was a past guest of mine. She's also in the health field. She's a registered nurse. And she spoke to us at the beginning of the year about the importance of health and so many things. So we really, really appreciate all of our amazing guests, all of our amazing viewers as well. All right. So there's a couple of things I want to tell you about. I wanted to tell you real quick about a telethon that's coming up, not this Saturday, but the Saturday afterwards. It's called the Peace and Love Academic Scholarship. And we're having a telethon, which is going to be raising money for youth in the Caribbean. So it's going to be a 12-hour telethon from 9 a.m. till 9 p.m. As a matter of fact, I think I do have a commercial for you. So without further ado, I'm going to play a couple of commercials. And when we come back, we're going to get into it with our guest and more good stuff. All right? Share with your friends. Share with your friends. If the past year has taught us anything, it has taught us not to rely on a job or the government to bail us out. Also, it has taught us how important technology is for business, education, and everyday life. If you're looking for ways to supplement your income using your phone and your computer, check out a few amazing options. Number 1, open an online store in a day. Sell products that are proven to sell. No experience necessary, no inventory needed. Select a product for $7 and sell it for $40. Take a leaf out of Amazon's playbook. Number 2, referral business. Get paid to simply refer business. Many companies don't use expensive TV and radio ads. Instead, they use referrals. The more customers you refer, the more the company pays you. You don't even need to use the products if you don't want to. Number 3, trade like the banks. Discover what the banks are doing with your savings and beat them at their own game. This skill will pay you for the rest of your life. Finally, if you already have a business, you're not tech savvy, but you need help marketing it online, we've got you covered there too. Contact MJ at 954-279-3893 or visit melissajane.com. It's that time again. The Peace and Love Academic Scholarship, PALACE for short, is holding its 4th annual International 12-hour telethon to raise funds for education in Jamaica and the Caribbean. It all happens on Saturday, July 17th from 9 a.m. till 9 p.m. Eastern. But we need your help to provide 80 scholarships this year. Visit palace1.org to see the success stories and to make your tax-deductible donations. We thank you so much.
Check out the latest member of the MSC Network. That's right, Melissa Jane Live is now on the MSC Network each and every Thursday at 8 p.m. Eastern Standard Time. You don't want to miss this show. I'm telling you, it is hot. She featured the latest and the hottest and the greatest indie artists. That's right. She also have real talk, business features, interviews, and so much more. It's so informative. It's so much fun. You don't want to miss it. I'll see you Thursday, 8 p.m. Eastern Standard Time on the Melissa Jane Live Show. I know it's a lot going on in the world today. And that's why I created the Rich Live Show. That's right. This is the one place you can come and cast all your worries away. We have the best and the latest old school, new school music for your soul. I guarantee you come to the Rich Live Show on Saturdays at 7 p.m. Eastern Standard Time. You won't regret it.
Who's ready for Wind Up Wednesdays? With DJ Red, Wind Up Wednesdays playing compa, reggae, soca, Afrobeats, calypso, salsa, merengue, and so much more. Right here on the MSC Network, each and every Wednesday, it
right, welcome back. It's MJ Live, and we're ready for our guest. Let's bring up Miss Donna Jarrett-Mays. Hey, Donna, how are you?
Hi, how are you? Can you hear me loud and clear?
I can hear you loud and clear, and you look lovely.
Thank you.
How you doing today?
I'm doing wonderful. Glad to
Oh,
be here. Thank you for having
absolutely,
me. I really
absolutely.
appreciate it.
So important. It's so important. We have such great information that we're about to share today. So, guys, please do go ahead and tell your friends, tag your friends, share the post, and get people in here, because this is a topic that is so important, right, especially right now as well. Welcome to Health Coach Adrienne. Welcome to Marva Riley. Welcome Tina Azell. Welcome to those listening on MSE Network. Welcome to those on Facebook and YouTube. We're here every Thursday from 8 until whenever. So put it in schedules. If it's your first time listening, welcome. And don't let it be your last. So this, everybody, is Donna Jarrett-Mays. A lot of experience in the insurance world, in real estate, in finances in general, and I'm sure she's going to tell us more. But let us first get into welcome Paula Scott as well. She's just got it in here. And welcome to Marcia Damaris. In your words, Donna, could you just give us a little bit introduction to who you are for us?
Sure. My name is Donna Jarrett-Mays. I am the owner and broker of Dream Team Realty, as well as the financial service company, ADJ Financial Services. We've been in business now for over 20 years. I've been helping clients from home ownership to obtaining health insurance, life insurance, travel insurance, dental, vision, all your insurance needs. I'm here to help. Most of all, I love educating, teaching, making sure my clients understand exactly what they're purchasing. That's very dear to me. So I love sharing the information to everyone. But I've been around for many years throughout the county, living in South Florida since I was a little girl, originally from Jamaica. And yeah, so I've been here for a long time. So been throughout the community, helping families, sharing information. And I'm just super excited to share the information tonight with your guests about what the marketplace in Obamacare.
Yes. So there have been a lot of changes, of course. Things change all the time as far as healthcare and legislation is concerned. And people are misinformed on a lot of things. If you don't keep up, if you're not in this industry, there are things that come out that you may not know about. And certainly for me, there are some things that I just learned recently as well. So I don't. Paul is saying she doesn't hear the Jamaican accent at all. Wow.
No, Paula, I've been here since I was 2 years old. But trust me, I'm a true Jamaican. I got all the roots of Jamaican.
Welcome, Dr. Karen Gaynor. Welcome to the show as well. So many people don't have health insurance. Great. So this is something that people are tuning in to hear. So can we talk about some of the misconceptions, some of the most recently, the most important questions that people always ask you, and just go down a list of things. And people, if you're listening and you have questions about Obamacare, affordable health care, whatever it is, drop them in there, and Donna will, I'm pretty sure she's going to be able to answer every question that comes along. Because you've been in this, especially for Obamacare, since it started, right?
I've been helping families throughout South Florida, Georgia, Texas, Alabama. I have clients throughout, the different parts of those states. So yeah, I've been around since its inception, since it started. And, Obamacare, it was enacted back in 2013, but it went live like back in 2014. That's when the open enrollment started. So most people were able to get affordable health insurance started back in 2015. So this is like my 8th year of doing enrollment. So I am super excited of everyone getting the information, because one of the things that I hate to hear Melissa, is especially when the enrollment period is over, someone call me and they're not able to get insurance and they need it. So it's very important for you to inform your friends, your family, that due to the pandemic, our president opened back up the open enrollment period since February, because normally the open enrollment season is only from November 1st through December 15th. But due to the pandemic, President Joe Biden decided to open back the enrollment period, giving people the opportunity to obtain the health insurance. And it's been open since February 15th, and it's going to close on August 15th. So it's just around the corner. We have almost less than 1 month away for you to have the opportunity to have health coverage during the open enrollment. So it's very important.
I bet you that a lot of people didn't know that it was reopened.
Yeah, a lot of people don't know. A lot of people think it's still closed.
Yeah.
And I'm trying, and thank God for people like you that is giving me the opportunity and to share it amongst the community so they will know, because, sharing the information is vital. And sometimes you guys, it could be your friends, it could be your brother, your sister, your cousin, even your mom that doesn't even have health insurance. I mean, just sharing a story. Just today, my doctor referred me to one of his office employees, and her mother doesn't have health insurance. And right now, as we speak, she's in the hospital. I mean, kind of terrible, and the good thing is she can get it.
Yeah.
But the unfortunate thing is it would not be effective until August 1st. So, because one of the things that most people don't understand, especially through the marketplace, you cannot call me today and think your coverage is going to start tomorrow. It normally begins on the 1st of each month. So, yes. So if you call me today, your effective date of when your coverage will start will actually be August 1st. So
the whole month, basically the whole month would have to pass before the next first of the month occurs. I mean, if you applied on the last day of the month or the last couple of days, then you've only got a couple of days to wait. But if you apply at the beginning of the month, you've got a whole month to wait before it kicks in. Is that right?
That's correct. That's correct. Wow. And that's very vital. And what people don't understand, one of the very, very important thing about the Affordable Care Act and what it has done for America is giving those it doesn't matter if you have a pre-existing condition. It doesn't matter if you're even in a hospital. You can get coverage. So you could have had a heart attack last year. It doesn't matter. You still is eligible for enrolling in the marketplace because there's no health question. So
can we just stay on that for a second? So even if you're in the hospital, you can apply for health insurance, but it won't kick in until the first of the month. Is that right?
That's correct.
But you can still apply for it.
You can apply. And you must make your payment, though. You must make your payment. We can enroll you, but your payment must be made in for it to be effective. That's important.
Right. Okay, so we're gonna get into it. We're gonna get into some of the common questions, but I want to go ahead and put up your information right at the beginning and put it up throughout as we're talking. So if anybody wants to get hold of Donna, just go ahead and read out your information for us.
Well, you can easily reach me. You can call me directly at 754-366-4888. My website is adjfinancialservices.com. You can find me on Facebook. I'm on Instagram, Donna Jarrett-Mays on Facebook, Donna Jarrett-Mays on Instagram. My phone number is there, and that is actually my direct number, guys. It's not like you cannot reach me. As long as you leave a message, I will call you back.
And she does. She called you right back.
Yeah, I will call you back. But if you don't leave a message, I have no way of knowing you call. So please leave the message and I will get back to you as soon as possible because I'm usually on the phone, especially during business hours, constantly. But I do check my voicemail because I am very much interested in helping everyone to obtain health coverage.
Okay, so let's take one of the questions immediately here. So Karen's saying, talk about the subsidies that people can apply for.
Oh, okay, wonderful. All right, so the way most people don't understand that when you apply for the marketplace, your credits and your subsidies is all predicated on two things. It's based upon the number of family members in your household, as well as the amount of income earnings you're earning will determine what your payment will be. So on the norm, those who are earning anywhere between the 100 to 400% of the federal poverty level will get what we call premium tax credits. That's credits that is given to the insurance company on your behalf by the government to allow them to lower your payment to make it affordable based upon where you're falling on the federal poverty level. Okay. And those who earn between the 100 to 250% of the federal poverty level not only qualifies for tax credit, but you also qualify for cost sharing. And the cost sharing is what helps to lower your co-pays, your deductibles, and your co-insurances when you go to the doctors and hospital. So it can vary. But, you know, what happened in February is when President Joe Biden signed the American Rescue Plan. See, that plan, he signed, that rescue plan, it consisted a lot more than most people understood. You know, we thought it was just about the $1,400. It wasn't just about the $1,400.
Oh.
It gave those in February, he signed it. And what that did for most people, it gave them additional credits because it went into effect on May 1st. So even though that you had coverage that started in January, February, and March, you've been making a payment. If you reapply your application, 9 times out of 10, you would qualify. If you were getting tax credit, you would qualify for some additional credits. And one of the huge thing is normally the tax credit is given to those that earn up to 400% of the federal poverty level. But with the American Rescue Plan, even those who now exceed the 400% of the federal poverty level is also getting tax credit to lower their payment. So that's been huge because some clients who, for example, if you were one person in your household only, earned up to like $51,000, and you would have qualified for some tax credit. But now you can get tax credit beyond $51,000. And that will continue through 2022.
Okay.
So it's not just going to stop at the end of this year. It will continue through next year as well.
That's huge.
That's very huge. So a lot of people don't even know that's happening. And one of the other big things, Melissa, that just took effect as of July 1st is if you are on unemployment or you receiving unemployment, and if you had received unemployment in 2021, you also are eligible starting July 1st for additional credits to lower your payments.
Well, so it really pays to listen to someone like Donna, who is so in tune with all of the different regulations, the amendments, the updates on this policy, because Donna has been doing this since it started. She's one of the first persons that got involved with Obamacare. I remember when you was doing this for the longest time. I don't know how I forgot the other day, but you've been doing this for the longest time. And people are actually sending you requests right now, Donna.
Thank you.
And wanted to get in touch with you. Welcome to MSC Network. That's Richard. Hello, Donna and MJ. Thanks for sharing this important information, says Richard. He's the founder and the owner of MSC Network, who I'm actually broadcasting on that channel right now as well. So we're not just going out to my show, we're also going out to other platforms.
Awesome.
Awesome. Rich, your website looks amazing right now. And Karen says, great explanation. So Marcy says, that info, huge. That's huge. I think I saw something earlier. Welcome, Novel T. Welcome, Abigail Young. If you have questions regarding Obamacare, affordable healthcare, anything like that, drop your questions in the chat room. Welcome to Gary Dixon. I wanted to ask something that you had mentioned. Now, regarding the subsidies or the tax credits, is it true that some people don't actually have to pay anything because the government will pay for them? Their premiums is zero. Is that true?
Oh, absolutely. I have quite a few clients right now, especially after the American Rescue Plan went into effect starting for May the 1st. A lot of my clients' premium was reduced, and now they're paying zero. And kind of give you an example, like, I have a client, age 40. He has 2 kids. He's earning like $22,000 a year in income. His premium is zero. I have another client who's 22 years old with 1 child and has an income about $18,000 a year, and their premium is zero. So it just depends. Everyone is different. Not everyone qualifies for their subsidies, for their credits to override their total original cost. But let me interject and state that your premium that you're paying is zero, but the payment of the insurance is not zero. I mean, it may just be your credit overrides the original cost of the insurance. So the original cost of the insurance may have been, say, for example, $413 a month, but you're getting $415 in credits. So what that does means that you're out of pocket, it zeroes it out. So I don't want anyone to think, oh, they're out there, the insurance is free. No, it's not exactly free. It's just that the tax credit overrides the original cost. So your outlay of what you're supposed to pay in premium is now zero.
Okay, here's a follow-up question to that. Does that mean, depending on what type of insurance you get, will let me see if I can put this a different way. Does the insurance that you're gonna get, is it gonna be a lower type of insurance because of all of this, or is the quality of the insurance still the same? If you know what I mean.
Yeah, I understand. Yes, the benefit is absolutely wonderful, and as I mentioned earlier, those who qualify for cost sharing, meaning their income is below the 250%. All what has happened here is that your co-pays and your deductibles went to zero. So for example, if someone who was paying a higher income, you may have, let's say, a $1,500 deductible because your income exceeds 250%. But if your income was under, like, say, 150%, so instead of having a $1,500 deductible, you now have a zero. But your benefit is not like it's less. You have the same. It's just that you're paying less, but you still have the opportunity to go see your doctor. You still have an opportunity to go see specialists, get blood work completed, x-rays, diagnostic tests, even go to the hospital or the emergency room. Only thing that changes is your outlay and how much your co-pays and your out-of-pocket maximums are compared to someone who have a higher income. But the benefits are equal.
Awesome. That's great. So Karen's saying, I vlog about the importance of getting healthcare coverage, but so many people don't get it, especially self-employed people. Appreciate the topic. So yeah, talk on that. Self-employed people. Do you come across any issues regarding this?
Oh yeah, absolutely. See, one of the things, I'm glad she brought that up, and thank you for that question and statement. Believe it or not, when Obamacare was enacted, I mean, self-employed people, you were top of the list in mine, because they understood that most self-employed people do not have health insurance.
Right.
Or if you work on a job part-time, you're not eligible for all the benefits like health insurance. So those are the people who benefit the most, because as a self-employed person, you get the opportunity to look at your income not based on your gross of what you're earning. We look at your net income. So it kind of helps you to receive more credits and have more subsidies applied, because we're usually looking at your net when we're trying to determine your income and where you fall on the guideline versus someone who has a job. We're looking at your gross. So self-employed people are my ideal clients. A majority of my clients are self-employed.
Oh.
Here in South Florida, there's a lot of my clients are home health aid workers, CNAs. I have a large book of business that consists of those people who work as lawn serviceman, handymans,
Entrepreneurs, that kind of
the
thing.
entrepreneurs. These are the ideal, because they benefit the most. So if you know anyone out there
Yes.
that they may not have it because they're thinking that they don't qualify. Of course they do. They probably benefit the most out of more people. And a good question that came up today, I got a phone call from someone, and they have insurance on their job. And they wanted to know, can they get Obamacare and insurance on the job? The answer is no. You cannot have both. You can't have both. And one of the other things I want to bring up, because Melissa is always, people, this is another myth or what people don't understand out there. Listen, ladies and gentlemen, if you are eligible for insurance through your employer, you cannot just make a decision not to take the plan from your job and opt into the marketplace and get tax credits because you think the insurance on the marketplace is cheaper than your employer plan. I mean, a lot of people think, oh, I'm not going to get insurance through my job because I think I can get it cheaper through the marketplace. That's not the way it works. It was never designed for the people who is eligible for coverage through their employer. But I must say, it's always a case-by-case situation.
Okay.
Because I do have some clients who can get insurance on their job, but the insurance on their job, the premium totally exceed the cost of what the government consider it as being affordable. So if it's not affordable, then you can opt out. But we have to look at your situation.
Every situation's different, you say.
I analyze it. I look at it. I run the numbers. I do the numbers for you, and I will let you know. Yes, it's unaffordable, so you don't have to take the plan through your employer. Or if the benefits on your employer job insurance that they're offering you doesn't meet what we classify as the essential health benefits, if it doesn't consist of things such as prescription drugs, or it won't cover you if you go to the hospital, then that's not what we classified as a qualified plan. So you then do not have to take that plan. So there's some things that can allow you to opt out and still qualify for the tax credits, but we have to look at it on a case-by-case basis. That's why you have to give me a call, and I will help you to make that determination.
Absolutely. And just to give the number again, the telephone number is 754-366-4888, and call Donna Jarrett-Mays. We've still got a lot to talk about. We're going to take a little short break, and we're going to be right back with your questions. We have some more questions in the chat room.
Come on.
Right now, it's a good time to tell your friends to get in here. We have more information, and you need to know this. You need to know this. Even if it's not for yourself, somebody needs to know it. All right.
Somebody needs to know. So we'll be educating you tonight.
Yes.
So you can share it with others.
Yes. We're going to be right back, guys. Okay. Don't go too far. If the past year has taught us anything, it has taught us not to rely on a job or the government to bail us out. Also, it has taught us how important technology is for business, education, and everyday life. If you're looking for ways to supplement your income using your phone and your computer, check out a few amazing options. Number 1, open an online store in a day. Sell products that are proven to sell. No experience necessary, no inventory needed. Select a product for $7 and sell it for $40. Take a leaf out of Amazon's playbook. Number 2, referral business. Get paid to simply refer business. Many companies don't use expensive TV and radio ads. Instead, they use referrals. The more customers you refer, the more the company pays you. You don't even need to use the products if you don't want to. Number 3, trade like the banks. Discover what the banks are doing with your savings and beat them at their own game. This skill will pay you for the rest of your life. Finally, if you already have a business, you're not tech savvy, but you need help marketing it online, we've got you covered there too. Contact MJ at 954-279-3893 or visit melissajane.com. It's that time again. The Peace and Love Academic Scholarship, PALACE for short, is holding its 4th annual International 12-hour telethon to raise funds for education in Jamaica and the Caribbean. It all happens on Saturday, July 17th from 9 a.m. till 9 p.m. Eastern. But we need your help to provide 80 scholarships this year. Visit palace1.org to see the success stories and to make your tax-deductible donations. We thank you so much. All right, guys, welcome back. It's MJ Live here talking with Donna Jarrett-Mays, the healthcare professional, specialist. She knows everything. She knows everything about Obamacare. So yeah, let's go back to the questions. So let's see. Right now we have Karen also mentioned, remember they can also apply for Medicaid at the healthcare marketplace. Anything you want to add to that or comment on that?
Well, you can apply far as, if you not eligible, let's say, for example, if you don't have any earned income, then you wouldn't qualify for any tax credit. However, if the application is submitted, Medicaid will receive it because the system are connected. Medicaid with Children's Health Plan are all connected. So if you're not eligible for the marketplace, you can then sometimes get enrolled. But then you may have to follow up through Medicaid because it really doesn't give you any direct access on the site for us to really check or do anything with Medicaid, not in the state of Florida. I'm not sure where they're from because Florida is not a state in which Medicaid was expanded. So they really can't, we can't go into the system and say, yeah, you were eligible for Medicaid. You will have to call Medicaid directly and contact them.
All right. So Marv is saying, my family member was without health insurance for 4 years and she just got POS. I'm not sure what that is, with Florida Blue, and the premium is $49 a month. Now she can breathe a kitty easier just in case something happens.
Right. I mean, exactly. Having health insurance is definitely important for everyone. You can't wait till you need it. It's just like, ladies and gentlemen, you don't get into a car accident and say, let me go get a car insurance for them to fix my car. You want to have it prior to something happen. I mean, I get people all the time that say, well, I'm healthy. I've never been to the hospital. Never. I say, yeah, that's your present situation and that's your past. But you do not know your future because all it takes for you to go to bed and wake up and now you're feeling pain and aches, and then the first thing you're going to think about is, oh my goodness, I don't have health insurance. And now you're stuck, because now you either got to do one or two things: go to the hospital, and now you will have to face the consequences of worrying about paying for those out-of-pocket costs. And here in America, going to the hospital is not cheap. It will cost you a lot of money.
Yeah.
And it's the fastest way to ruin your credit in America by not paying your bills. So your hospital bills. So you want to make certain you protect yourself. I mean, ladies and gentlemen, a lot of the people out here listening, your premium could be very affordable, very affordable. It's not like it was prior to the Affordable Care Act, where your average cost was, most people were paying like, $300, $400, $500, $600 a month. If you qualify for subsidy, you get it. But if you're making a lot of money, you can afford it. So, hey, it works out. It's all based on your income levels.
All right. Karen says, a lot of doctors don't like Obamacare, but most accept the insurances. Medicaid patients find it hard to find doctors, so most choose a HMO.
Well, yeah, a lot of doctors, they take it because guess what? They're going to lose their patients. And
it's the law.
Well, the thing is, a lot of doctors found out very quickly, those who may have decided that they wasn't going to take any of the plans, they saw that their numbers dropped. Because, if they're not in the network of any of the plans on the exchange, the patients are not going to go to them. They're going to go find another doctor. And guess what? And one way to hit anybody real quick is in the pockets. When you look up and you're not getting as much money as you used to because all your patients have went elsewhere.
Right.
Normally, guess what happens? They'll get on.
They'll get on board.
They get on board, even though they may not want to be on board, but they get on board. And guess what? More and more has made the decision because they see it's here. And, with the Democratic Party in place, it's not going anywhere. And the good news is we're anticipating come next year, 2022, there's more companies that may come on board in your areas, wherever you are, because, the way it works, depending on where you are, there's different plan options. What's here in South Florida may not necessarily be in a different county. So it depends on, or a state. So it depends on where you are, will determine which company options of choices you may have.
Okay. Welcome, Trina's Treasures. Welcome, Trina's Treasures. She's over on MSC Network. So welcome to you guys, to you here. And if you have any other questions, drop them in. And we're going to go back to you, Donna, and talk about some of the myths and things that people may be unsure about. Medicaid patients can't get Obamacare either, but can choose an HMO or PPO, etc. Looks like Karen may be in the industry too.
Yes, you can. They cannot have Obamacare. Not only do I help families with the Affordable Care Act, I also do Medicare. So I help those who are under 65 and over 65 who are eligible for Medicare or Obamacare. I do both. But no, if you are eligible for Medicare, you cannot accept the Obamacare unless you only eligible for Part B. If you're eligible for Part A, you cannot get it. But if you're not eligible for Part A, but you are eligible for Part B, you can get the Marketplace.
So Medicaid, it seems like there's quite a lot of information regarding that. Is that a whole nother show? Medicaid and all of that? Because I don't know too much about that, I got to admit.
Well, mostly Medicaid are for people who have low subsidies, qualifies for Medicaid. I don't do Medicaid.
Oh, okay.
I mostly deal with individuals who are qualified for the Marketplace or they qualify for Medicare. But Medicaid is usually done through the Department of Health, Children and Families. They can go to medicaid.gov and register for Medicaid and apply there. But I'm not
Gotcha.
that much involved with Medicaid.
All right. So Marva says, "Great information. Let's pass on this information to as many as we can." Absolutely,
Thank you, Marva. Absolutely.
and you
Thank you.
have Donna's information. It's right here. Just take a screenshot of it with your phones if you're listening on your television screens, which you should be, by the way. You watch me on your TV screens. It's the telephone number is 754-366-4888. Donna is the most experienced person I know on this topic. Let's see what time we have. Let's see if you have any more questions. So Donna, any other sort of myths or things that people kind of are not sure about regarding you got me talking about Medicare now. The Obamacare or affordable health care. Anything else that we need to know?
Well, the important thing is you got to share it with people. You need to get enrolled because every situation is different. Do not listen to others. Get professional, the expert advice, because you may hear someone say, "Oh, I'm paying $200-300," which is very well possible, depending on their income. But that doesn't mean that that's the shoe you would wear. You may be paying a whole lot less. And I get it all the time. And people don't understand that if you don't pay your premium, it will get terminated. You must pay your insurance premium, so, and they give you 90-day grace period, really, to pay your premium. So make sure you pay your premium, because after August 15th, you will not be able to join the marketplace until
the next year.
Correct. Till January. The open enrollment will begin again November 1st. We're not sure if it's going to end December 15th. They haven't really told us yet, but on the standard, it's November 1st through December 15th. But your effective date, even though you're enrolled in November, your effective date would not be until January 1. So you don't want to wait.
Yeah, I have a question actually. Now a lot of people, they'll just have the insurance. Let's just say you're enrolled in something for the year, and then the next year comes around and you just like roll it over. You don't bother to do anything major. Is it a good idea to roll it over, number one, or is it best to speak to somebody like you and just get the updates on what's happening?
Oh, absolutely. I always encourage all my clients. I re-enroll every one of my clients who I can get in touch with during the open enrollment, because things do change. Company premiums could change. The co-pays can change. And then you may have other options of companies that you can choose from. Because guess what? Your doctor may change. Your doctor may no longer be in that network. So they have the right to make a decision to no longer accept that plan. So by the time you realize that, the enrollment period would be closed. And then unfortunately, you would not be able to change plans, because when it's not open enrollment period is open, you cannot make any changes unless you qualify for what we call a SEP, which is a special enrollment period. If you qualify for a special enrollment period, then there's a possibility of you making a switch or a change. But that's why you want to get it done during the open enrollment period, because I've seen it. I've seen where clients of mine, 1 year they was with one company and they were paying, say, for example, $30 a month. But now the new year, that same plan now is going to cost $70 or $80 a month. And they like, wow, it more than double. Yeah. But if you would have called me, we could have analyzed your situation to see if there's something that can shift in your application so that either you pay the same or you switch to a different carrier and get a different plan, because things do change.
Yeah.
Because your plan with your coverage is really only good for the year in which you're in, which is 2021. Anything, the insurance carrier has the right to make adjustments and changes the upcoming year.
Right. So, and your part of what you do as when you're working with a client is to look through all the different types of insurance plans, and you sit down and you just kind of design or select what's right for them as an individual, the right plan for the right person.
Correct. Based on their needs.
Based on their needs. Okay. Excellent, excellent, excellent. So we have a Facebook user. What must your income be to enroll in the Obamacare?
That depends on the number of family members. I mean, it could be as little as $12,760 is the minimum if you're just one person in the household. But it all depends on how many people, is in your household going to determine that minimum. The best thing to do, give me a call. I analyze your situation and I'll let you know exactly what it would cost or what the minimum would be for you based on your situation.
Again, if you're just joining, Donna's number is 754-366-4888, 754-366-4888. She has all of the information that you can need on this topic. All right. Any other final things on Obamacare before I want to give you an opportunity to talk about your other businesses, any other projects you're working on right now?
Well, the main thing is, ladies and gentlemen, you want to get out there and share this information because you may assume, never assume. Ask the question. Do you have health insurance? Do you realize the marketplace is open at this time? But it is closing August 15th. So pass my information on. I do not charge to speak to you over the phone. And you can either come in to the office. I do have an office, or we can speak over the phone. You don't have to come in. Most of my enrollments were done this year via phone, especially during the pandemic. I did most of my enrollments over the phone, unless, we had some people who may have wanted to come in, and I was allowed them to come in. We did all the, follow the guidelines of making sure wearing masks. We did those things, but most of it was done over the phone. So you don't necessarily have to come in, but I am located. I do have an office space.
Mm-hmm, mm-hmm. All right. So let's talk about your other businesses that you do, because you're very versatile in what you do and so experienced in lots of different areas. Talk about those, please.
Oh, well, thank you for that opportunity. I not only do health insurance, but I do help families with life insurance. Life insurance is very important. We protect our health, but unfortunately, sometimes our health fails and put us in a situation that causes us to die. And you have to have your life insurance in place in order to be able to bury your loved one. So, and not only that, especially if you're a breadwinner, you want to have your family protected, because when that income goes away, what happens to your family? Mm-hmm. So we do analyze that and making sure that you have the proper amount of insurance that you need in order to continue, so your family would continue to live without you. Mm-hmm. And also we do strategies. I have partnered with the Henderson Financial Group, which I will be on the show on this Saturday at 10:15. You can join Robert and I and James T. from Hot 105, those who are here in South Florida. I'll be on that show speaking again, sharing some of this information with the finance. You can go to Facebook and go to the Henderson Financial Group. I partner with them because we're all about educating on many different topics for your finances. We do from life insurance. We teach different strategies for retirement. A lot of people out there are, especially self-employed people, they're not saving for retirement. And one day you're going to get older and you don't want to work forever. So how much money are you putting away for retirement? We teach different strategies so that you can have maybe a tax-free retirement. See, most people don't understand that most of their incomes in their 401ks are going to be taxable income. Your Social Security is taxable. So do you want to continue paying taxes forever? Or are you looking for ways to no longer pay taxes? We teach those strategies. Wow. So these are the things. And of course, as a real estate broker, mm-hmm. I help people with home ownership. I serve on the Housing Financing Board of Broward County. I sit on that board, been sitting on that board for many years. because I believe in helping families to have home ownership. So right now, prices are crazy in South Florida, but home ownership is very important. You don't want to be a renter forever. You
Right.
need to own something. You need own piece of the land,
Right.
here in America that you call your own. So we teach and we help people with there are first time home buyer programs available that can assist you with down payment assistance. It's out there. It's available out there for you. So these are the things that we like to share and want you to know. You tell us your needs and we'll give you direction. Not only do I do the Obamacare, if you need dental insurance, if you need vision insurance, a lot of times people don't understand that, having bad dental hygiene can lead to heart conditions. And if you go get your eyes checked, sometimes your optometrist can see things that's developing to help you protect your health. So these are the various things that we offer. How many people out there likes to travel?
All right.
I mean, a lot. We live in South Florida. A lot of people jump on planes, go aboard, go to different countries, and they don't understand that their health insurance does not go with them. It stops at the U.S. border. So what happens if you get sick in another country, especially if you're in a third world country and the hospital is not that great?
Right.
What do you do? I mean, you'll be very surprised how it's so little cost for health insurance protection outside the U.S. So I have various different plans that I sell. We can talk about your needs and I can guide you, because that's what we do. We strategize. We strategize. I'm like a financial strategist.
Wow. Amazing. Anything else you do before we put up our last question? Marlon came in. Hey, welcome, Marlon. I love my medical plan, but I'm paid twice what I paid last year for the same plan. So I believe that he's an employee, so he works for a company, so he's not going to be using Obamacare. But is this somebody that you would still speak to see whether it's an option to come out of the company's plan? Or
Well, again, there are rules in place that allows you to opt out if it's classified as unaffordable. You have to give me a call and I can ask you a few questions and help you to make that determination if it's unaffordable or it's affordable.
Got you. Again, telephone number is 754-366-4888. All right. I think with that, we've probably covered everything. Do you think, is there anything that I may have missed? Let's see what the time. We just got 5 minutes to go.
One last thing I want to just interject here.
Hold that thought there, Donna.
Okay.
But Marla says my plan is through the Obamacare. You definitely need to speak with Donna then.
Give me a call. Yeah, because I've helped. There's many people who that's in your situation, Marlon, and when they call me, they realize I was able to help them. I can give you so many stories on that topic of so many people who I've helped, get them to save some money, because maybe the way they did it or whoever did it didn't do it correctly because they really didn't understand what they were doing. So give me a call. I'll happy to analyze. If you're in the right plan and you're doing the right thing, there's nothing I can help you, then hey, but at least it's better for you to try, and then I can tell you, please give me a call. I'm happy to share. I'm happy to look at it for you, and there's no charge to it. So, but one of the things that I want to mention, because a lot of people are considering leaving their job, or they want to leave their job. They may want to become entrepreneurs, but they probably figuring, oh, if I leave my job, I'm going to lose my coverage.
Yeah.
Listen, if you lose your job or you leave your job, you can then roll onto the marketplace. So don't let that stop you from making that decision. You can always give me a call. As a matter of fact, just today, I have a client that I enrolled a lady who she's leaving her job come next month. She's 61 years old, so she's not ready for Medicare yet.
Uh-huh.
However, she's ready to take, her pension and come out. And when she was looking at Cobra or some other plan, it was going to cost her $800 a month.
Wow.
And I enrolled her today, and now she's only paying $200 a month for that.
My word.
So, I'm helping. I help you.
You are helping, Donna. You're helping so many people.
She is so excited, so she now feels very secure because when she leaves her job July 31st, her insurance through the marketplace starts August 1. She's doing it right.
Perfect.
You don't wait until you need it. You get it prior to, and you'll be on time and on point.
Excellent, Donna. People are texting me for your number. I just threw it back up on the screen. So, we're providing information for the community. We definitely want to help. And as you guys know, you've seen the show most of this year. We've had guests on who have come on, and they've given you value. They've taught on something. They've given you information on something. You're able to sit there and ask questions. So we know that we're doing a good thing here, Donna.
Wonderful! I love it. I love sharing. I mean, come on, my clients are like family to me. We are good people. That's how I treat my clients. They're we like family over here. Yeah,
okay.
So.
All right, Donna, I want to thank you so much for providing this information for my audience and for MSE Network, for the Facebook people, for the YouTube people. Thank you so much all for tuning in. We're going to end the show right now tonight. There's so many things going on in our lives. I want to thank each and every person for tuning in tonight. Welcome, Junior. You're a little bit late there, my brother. If anybody missed this information, go back and watch it from the start. As soon as we finish it, it's going to be available on Facebook and YouTube. So again, with that, I want to thank you again, Donna, and we shall talk soon.
Thank you. Appreciate it. Thank you all for joining us. We appreciate you listening in. Melissa, you're the best. You're awesome, girl.
Oh, thank you. So are you. Talk shit a bit.
Okay, take care.
All right. So, all right, guys, I want to thank you so much for tuning in. I'm just going to leave you with one more commercial just to let you know about the Palace Telethon happening, not this Saturday, but the following Saturday. And of course, my business. Most of you know now that I'm providing some other services as well as my digital marketing, and that's what this commercial is about that you're about to see. I kind of held back a little bit on providing this at first, but what I realize is there are some people that are out there looking for business opportunities. They're looking for a way to make some extra income, and it's up to me to share. I'm not going to push it in your face, but if it's something that you want, or of somebody that just wants to make an extra income, then there are options out there, and I can walk you through it if you so wish. So check this out, and I'll be right back afterwards. If the past year has taught us anything, it has taught us not to rely on a job or the government to bail us out. Also, it has taught us how important technology is for business, education, and everyday life. If you're looking for ways to supplement your income using your phone and your computer, check out a few amazing options. Number 1, open an online store in a day. Sell products that are proven to sell. No experience necessary, no inventory needed. Select a product for $7 and sell it for $40. Take a leaf out of Amazon's playbook. Number 2, referral business. Get paid to simply refer business. Many companies don't use expensive TV and radio ads. Instead, they use referrals. The more customers you refer, the more the company pays you. You don't even need to use the products if you don't want to. Number 3, trade like the banks. Discover what the banks are doing with your savings and beat them at their own game. This skill will pay you for the rest of your life. Finally, if you already have a business, you're not tech savvy, but you need help marketing it online, we've got you covered there too. Contact MJ at 954-279-3893 or visit melissajane.com. It's that time again. The Peace and Love Academic Scholarship, Palace for short, is holding its 4th annual International 12-hour telethon to raise funds for education in Jamaica and the Caribbean. It all happens on Saturday, July 17th from 9 a.m. till 9 p.m. Eastern. But we need your help to provide 80 scholarships this year. Visit palace1.org to see the success stories and to make your tax-deductible donations. We thank you so much. All right, guys. I just want to let you see last few comments, or I'm just seeing the last few comments. DJ Smooth just joined us. Evelyn Adams, Miss Adams has joined us. Welcome, Junior Martin. Welcome, Novelty, and everybody else that was tuned in tonight. Marcia says she needed this piece of information tonight because she's headed down the road of early retirement. Absolutely. And you definitely want to get your health insurance in check, in order. Novelty has got her 2 scholarships ready to partner with Palace. Thank you so much, Novelty. You've been partnering with Palace for years, I believe, and we really, really appreciate that. I'm going to give more information next week about that, because by next week, we'll only have a few days to go before we're going to do the 12-hour telethon. So many things going on. I don't barely have time to lift my head up. All right, guys, I'll see you next week and have a wonderful time. Remember, DJ Rich is on Saturday night. So if you want to hear some music on Saturday night at 7 o'clock, tune into DJ Rich's show over on MSE Network. Just go over to megasourceentertainment.com. megasourceentertainment.com and check out the brand new website. It looks absolutely amazing. All right, guys, I will see you next week. Bye-bye.